Welcome, everybody. I'm Graham Walker, Executive Director at the Independent Institute in Oakland, California, and I'm delighted to welcome you to our Lighthouse briefing call this morning. We welcome our close friends who support the Institute's work to these briefing calls periodically and when circumstances seem to require it, as the current situation clearly does. So we especially want to give a special welcome to all our Lighthouse Society members, which is our community of donors who generously give us over $1,000 a year annually. Thanks to their support, Independent Institute operates from a position of health and strength. And today, as part of that effort, we are especially pleased to bring you the second briefing call in our coronavirus crisis series. In view of the widespread impact of COVID-19, we are also opening the call to a number of our friends who are not yet Lighthouse Society members. We hope you enjoy this call if you're in that category and you consider becoming a Lighthouse Society member yourself. So over the past couple of weeks, the Independent Institute has taken an active role in reviewing governmental responses to the crisis. And we've provided some insightful commentary with, I think, some important results-oriented solutions. Of course, we're all sheltering in place, social distancing, doing our part to so-called flatten the curve. I am working from my home, as are most of my colleagues. So thank you, everybody, for joining us. So speaking of flattening the curve, today our topic is trust private enterprise to flatten the curve. And I am joined today by our research fellow, Dr. Raymond March. Dr. March is a faculty member at the South Dakota State University in economics. He's also a faculty fellow at the Center for the Study of Public Choice and Private Enterprise, and is the director of Independent's own FDA Review, which is a crucial website monitoring FDA activities. Welcome, Dr. March.
Well, thanks for having me. Glad to be here.
Yeah, it's a pleasure to have you. I invite people, to look at your work at our FDAReview.org site. We appreciate your ongoing work there, but suddenly your work becomes even more critical as we look at this crisis. So we are going to review some of the work you've been doing recently, Dr. March. May I call you Ray? Is that okay?
Perfect.
Okay, great. Got a bunch of people from around the United States calling in, listening in, and later in the call, of course, we will give people the opportunity to ask some questions. So if you're on the call, hang on, and we will shortly be opening the line to those of you who would like to ask your direct questions to Dr. Ray March. So Ray, looking at what's going on here, what took so long to get the testing going? Why didn't we just have testing right off the bat?
Well, to make a long answer short, fundamentally it's about regulation. So when you look at, for instance, testing going on around the world, especially in South Korea had almost 250,000 tests ready to go 2 weeks after the first COVID-19 case was confirmed. And Korean testing kits have been distributed in China and Germany, Italy, France, Canada, but they're not distributed here. And so, of course, in my research, I wanted to ask, okay, well, why not in the United States? Obviously, we have a COVID-19 problem here. Why aren't we using these
we probably have a lot more scientists than the South Koreans do. So what was keeping them back?
Fundamentally, it was the FDA, and it was really two different reasons. The first of which is when you want to import a medical device, in this case a COVID-19 testing kit, you have to have inspectors inspect them in that state. So they would have to have South Korean inspectors inspect them, and then U.S. inspectors working on behalf of the FDA inspect them there, but the FDA called all their inspectors home.
I see.
As soon as cases started to emerge in China, they said, okay, well, we're going to interrupt this. We're going to bring all the inspectors home, which means that they couldn't approve any of the Korean testing kits.
Well, so Ray,
we don't have them.
In the U.S., to get a test approved, what's required?
If you want to get a test done in a laboratory that's not a public laboratory, you have to have a certification, at least up until a couple of weeks ago, from both the FDA and the CDC. And that was a certification process that took months. I mean, just look at the last month, how unfortunately fatalities and confirmed cases have ballooned up. Now imagine that regulation was still in place. We still would have no idea how many people were sick.
So in other words, they had approval barriers, and then they took down the approval barriers.
They did, and thank goodness they did. As soon as they did, I mean, literally, we're doing 100,000 tests a day from private laboratories, and that started almost immediately after they removed that barrier.
Okay, so like this is part of a series of things, which I hope you can explain to us and to our friends, where the U.S. was rendered less equipped and less ready to handle the crisis because we had so many restrictions on private activities, both testing development and medical supply development. Same thing's true with masks, is it not, and ventilators?
Unfortunately, it's true in both. So we're not allowed currently to import medical masks from any country, at least not ones that are up to the standard of preventing COVID-19.
Okay. And what about the U.S. production, domestic production of these items? Are there restrictions and approval processes that limit that progress too?
Very much so. It's considered a medical device, which means it has to go through the FDA approval process. On the mask side especially, we're fairly fortunate in that private enterprise has been stepping up, like Brooks Brothers is developing these. That might be the producer of your bow tie, I'm not sure, but now they're stepping in and saying, it might be, I don't know. But now they're stepping in and saying, well, we're gonna make masks, and they're making hundreds of thousands of them a day.
But is that partly because there were restrictions that were lifted on their previously being able to do so?
They've lifted some of the restrictions, unfortunately not the ones on foreign imports, but yeah, they have loosened back some of those restrictions, realizing that medical professionals need them. Now the CDC really has gone back and forth on whether or not just the public needs them broadly when they go out and do what little they're allowed to do, frankly. But yeah, they have rolled back some of those restrictions, and because of that, private enterprise is stepping in. That shortage will hopefully be resolved in a couple of weeks because dozens of fashion outlets and clothing producers, Fruit of the Loom, and a variety of others are stepping in and making these masks.
I'm not sure I want my mask to look like it came from Fruit of the Loom.
Desperate times.
Yeah, I want a Brooks Brothers mask. How about that? So what's going on here, to be really clear, you're an economist, are these companies stepping up because the government mandated that they produce a certain number of things by a certain number of time and so forth, or are they responding to the market that obviously has grown for these items?
I think it's 95% the market.
Mm-hmm.
So let me give you an example. President Trump recently ordered General Electric to produce ventilators, and they haven't been able to produce any. This order went out about a week and a half ago. Whereas across the Atlantic, Dyson is now producing ventilators. They're making about 15,000 a day. They've even donated 5,000 just to the general relief efforts of COVID-19 across the world. And they didn't receive a government order to do so. They just simply said, well, we need less vacuum cleaners and we need more ventilators.
And you know,
they built one in 10 days and now they're mass manufacturing them.
Wow, that's fantastic. And they were able to do that because there wasn't a restriction on their creation and production and distribution. Is that right?
That's right. The National Healthcare Center they have in the UK rolled back restrictions on ventilators, realizing that their hospitals didn't have enough. And that's the situation we're seeing across the world, unfortunately. But they said, we're going to roll it back. Dyson saw an opportunity and said, okay, let's make it quick. And they did. Yeah. But that's what you expect private enterprise to do.
So Dyson saw an opportunity. I really like the way you put that. I have no doubt that there are a lot of people, both owners of Dyson and employees of Dyson, who are motivated by a desire to serve the public good and compassion and so forth, but they saw an opportunity and that galvanized them because there's actually some profit to be made. Does it serve the common good for companies like this to respond to higher prices and notice the opportunity to make a profit in producing these things, or would we be better off if they couldn't make so much profit?
I think without the profit signal, and especially in a market, they wouldn't know how many to produce, how to produce them, what they could cut back on producing other things for, right? So how many less vacuum cleaners do we produce and how many more ventilators? Right. How do we make them? How do we know we're going to make them effectively? You wouldn't know that without a market. But to go back to your earlier point, what's really wonderful about the market, which is unfortunately crushed in a lot of times, especially in healthcare with regulation, is you get both, right? You get profits when you do a good job, but you also affect the common good.
Yeah, precisely. And if we were dependent wholly upon everybody's goodwill, I'm not sure there'd be enough stuff to supply these kind of crises. And had these restrictions not been in place at the beginning, I think we would have been better off in responding to the crisis in the first place. Is that right?
I don't think there's any question. I think that private enterprise drove South Korea to be pretty much the only country in the world at this point that has a reduction in cases enough that more people are recovering than getting sick. That wasn't a result of, even though they have a national healthcare system, that was a result of private enterprise.
Can you give us some other examples in the United States? You mentioned ventilators. What's going on with ventilators?
Ventilators right now, as best as we can tell from our estimates, are going to be in a shortage if current rates continue, and there's a lot of people that expect they will. But ventilators is an interesting topic in the sense that we have about 62,000 of them. That's not going to be enough by most estimates, but various different organizations and even just ground up organizations are trying to find ways to produce them. So right now there's a grassroots movement. It's across the United States. It's called the Pandemic Ventilator Project. It's engineers and medical professionals, entrepreneurs broadly, are using open software systems and sharing blueprints about how to make ventilators cheap and effective. And right now they are creating them, I kid you not, just using stuff they bought at a Home Depot, essentially.
Really?
Yeah. And rural communities and rural hospitals are buying these up because they can't afford to buy ventilators from other states.
So do they have to go through one of these long drawn out approval processes to do that?
Right now they currently do, but there's a lot of states that are lifting restrictions on that, at least at the state level. The FDA is also working to reduce just overall regulatory barriers to getting ventilators approved because ventilators are already approved. It's just a matter of what specifications they need to meet. But I mean, look, I'm teaching in North Dakota, right? Most of our hospitals here are rural. If there is an outbreak, especially in Fargo, which is sort of the main hub, we're not going to have enough.
Right.
But if it just takes engineers and medical professionals going to Home Depot, we can make it. But that, again, that wouldn't be possible without entrepreneurship in the private sector.
Tell us a little bit about the medications. I mean, vaccines are a long way off, I guess, but what about medication? We hear a lot about different drugs that seem to have dual purposes. Should there be more ability to try out these medications like hydroxychloroquine and so forth? What's going on there?
Yeah, hydroxychloroquine, probably most of who we're talking to are aware of this. It's being used off-label, meaning it's approved by the FDA. It's approved actually to treat malaria, but they're using it to try to beat back COVID-19. Physicians basically across the country are using that, trying to take care of the more serious cases, right? To avoid getting people on ventilators or putting them into medically induced comas. They're trying to treat them with this, and it's by and large shown a lot of success. But even there, because off-label use of drugs for very few restrictions is legalized, right? It's not prohibited by the FDA or monitored by them really to any extent. They're able to serve patients again. You also mentioned vaccines, and for vaccines is going to be tricky because even with the FDA's expedited approval process, that's probably about 2 years away. Some will estimate 1.5 years. Most are saying it's going to be closer to 2. One avenue I've explored just sort of in a recent publication I wrote for The Independent is why don't we try right to try laws to use that?
Right. Explain what that means, please.
Sure. Right to try laws were initially approved everywhere. It was signed into national law in 2008 by President Trump. Right to try laws say if you have a terminal illness and you don't have a drug that's and there's no treatment or a treatment that's fully approved by the FDA, as long as your physician and the drug producer agree that it's worth trying, you can bypass the FDA's approval process and use it. Now that hasn't been used in the case of a vaccine before, so this would be kind of uncharted territory, but I mean, at the same time, it's clearly fatal for a lot of people. It does get a 2-year process out of the way, assuming people are comfortable trying the vaccine and the producer is comfortable using it on people. So right. That could be an avenue people might want to explore.
Yeah, that's kind of encouraging. I mean, I don't think anybody needs to say, oh, well, it'll cure everything. Nobody has to make that claim. And of course, we do hope that there are carefully medically and scientifically controlled tests of new drugs and so forth. But if there's something that can work, I mean, how does it hurt to have both right to try as well as careful clinical trials simultaneously? That's possible, right?
It's entirely possible. It's been done before. One of the things that's tricky about clinical trials, especially in a case where travel is very restricted and there's a lot of quarantine orders going on, is if you're very sick and you want to try the vaccine, or you might be susceptible to getting it and you want to try the vaccine, you may not be able to access a clinical trial. So like right now, there's about 800 clinical trials going on in the US. They're geographically distributed. It's not always clear that you might be able to access one. But right to try, again, as long as you can go right to the drug producer and your physician believes it's a good idea and you, the patient, agree to do it, again, you avoid sort of that process.
Okay, so you're an FDA specialist. You're also an economist. I'm looking at some of the ways in which governments, both state and federal, are responding to this crisis. Some of them are good. I mean, you've illustrated ways in which there had previously been restrictions on development of tests and equipment and so forth, and those restrictions have been reduced so that people can start working on generating them without detailed approvals by the state. But then let's talk about other activities. There's a lot of economic impact of this shelter-in-place action that's going on. I understand that in a crisis, sometimes drastic measures are temporarily necessary. We can't help wondering about the economic impact. And moreover, as a student of civil liberties myself, I'm concerned that Americans will get comfortable with the idea that government, state, and federal can force them to stay home kind of at will. To the degree Americans get comfortable with this kind of restriction on their liberties, that couldn't be a good sign for the long run, could it?
I think ultimately it's a pretty serious sign for the long run, especially in terms of liberties. You might question how government got the ability to shut down the state of California to begin with, right? I mean, they're trying to do similar things here in North Dakota. But I mean, broadly speaking, in terms of the economic outlook, what we're doing is trying to what's called flatten the curve, right? Spread out the amount of cases that are going to happen over a longer time frame without trying to overwhelm the healthcare system. I mean, thus far, we've squashed essentially a quarter of the GDP, right? Estimates range from 13 to 24% of what I've been seeing. And that's all just to try to flatten out the curve. And that's interesting, but what I've been trying to do in my research is say, well, I mean, if we're trying to flatten the curve not to hit healthcare capacity, why is healthcare capacity where it is? And when you look in the private sector and something hits capacity, they don't shut down the business, right? Or tell the consumers to stay home. They say, we got to find a way to serve these consumers. And government programs do the opposite. So what I've been trying to do is examine, so why isn't private enterprise making more ventilators? Or are they, and we're not knowing about it? Or why aren't they trying to find a way to get more masks? Or why aren't they trying to expand healthcare or hospital bed capacity? And some states are doing that. That's what I've been trying to examine. And frankly, I think that's a lot safer of a trade-off than trying to flatten the curve and squash a quarter of the GDP. And like you mentioned, right, put our civil liberties on hold for, I mean, who knows how long.
And you know, the thing is, it's not just civil liberties. It's also that when the economy is so badly curtailed, this is going to have other effects which could make especially vulnerable citizens even more vulnerable and make them more susceptible to the virus itself. If people are unemployed and miserable and losing their ability to take care of themselves and can't use their health plan the way they used to do, all these are the health effects of the economic curtailment. Even though the economic curtailment is being done to benefit health, in the long run, it could come back around and bite us. I'm just a layman, but that seems to me, in economic terms, what could happen.
And unfortunately, that's not unusual in health policy. Or you take an outcome you want to avoid, right? Spreading COVID-19 or a disease or any kind of harmful, healthful outcome, and you enact a regulation to try to prohibit it, and then it ends up getting worse. Like we've seen that with vaping. We've seen that with smoking in the past. We do tend to see it with infectious disease, and it's unfortunate, but those are kind of the trade-offs we're making right now.
There are other examples of things, countries that are handling it a bit differently. I was reading about Taiwan recently. In Taiwan, like in South Korea, they have massive testing, and they required or encouraged people who were testing positive or who with those who test positive to stay at home, but not everybody. They closed schools where testing showed symptoms, but didn't close schools where they didn't. What kind of approaches are we seeing in other countries that could work better than massive shutdown?
Broadly speaking, there are two, one of which is massive shutdown, right? We see that in Italy. We're starting to see that in Spain and France. In certain areas of China, we saw that. The other approach is, let's not shut down the economy. Let's figure out where the pandemic is spreading, which populations are most vulnerable, which populations are most likely to spread. And then once we know a little bit more, let's try to isolate those communities. So one approach might be that everybody's got to stay home to avoid getting the elderly population sick. The other one is saying, how is the elderly population likely to get sick? And if they do, how can we help them? So if you will, don't shut down the economy, right? Because that's going to make the entire system worse for everyone. It's try to figure out specifically how do we target those groups that are most in need.
Yeah.
And
so
South Korea, by the way, implemented this too, right? They refused to shut it down because they said we're a democrat, oddly enough. They said we're a democratic society. We don't shut down. What we do is we try to treat the problem as we go along. But all of that, again, goes back to testing, right? You've got to have the testing, and private enterprise provides it in those places. We didn't let it do it here.
Yeah, we held our own private enterprise in check, and so we weren't ready for the crisis. Maybe we're going to learn something from this. Maybe we're going to learn that better to leave the barriers down in the first place so that we'll be better prepared for a crisis when it hits us rather than reacting to a crisis and reducing the barriers. So example, here in California, Governor Newsom, he gets some things right and some things wrong, like all of us, but I noticed interestingly a few days ago, he superintended a shift in California regulation allowing recently retired medical providers, doctors and nurses, as well as people whose licenses have recently lapsed on an honorable basis, you might say, to be eligible to provide medical care, notwithstanding the previous prohibition on that. And I think within 24 hours, he had 25,000 people volunteered to sign up for this California healthcare, people who would have been able, who were prohibited from serving the public. And suddenly the restrictions removed so they can serve the public. And we've got all these people, they're responding because they weren't allowed to respond before because the state restricted them, but now they can. That's amazing, isn't it?
It's remarkable. I mean, fundamentally, when you're talking about a crisis, a medical one, a pandemic, or any sort of crisis, what the easiest way to solve it, or the best way, is to get the best and the brightest people working on it. And I think the only way you can consistently do that is through a market.
Exactly.
And sometimes when you have regulations prohibiting the market from working, like in the example you just gave, right? All it takes is a little bit of reduction in occupational licensing laws and some of the other ones that your governor reduced. And then suddenly there's 25,000 more people ready and willing to help out sick patients. And it's remarkable.
Yeah, it really is. So notice that Governor Newsom, he didn't issue orders commanding recently retired doctors or people whose licenses recently lapsed that they must show up for work on penalty of whatever. He simply lifted the prohibition, and then voluntary, public-spirited, and obviously some degree self-interested people with a little more income, they all come forward. It's great. We're all better.
Take both, right?
Yeah, take both, exactly. That's the key thing here. Okay, so now let me just pause for a minute. Those of you who are on the call, and there are quite a few from around the country, I appreciate that. If you have questions you would like to submit, in a few minutes I'm going to give you a chance to use the Zoom function and raise your hand, and I'll unmute you so you can ask your question in your own voice. The reason everybody's muted right now is because if everybody's microphone was open, there'd be a cacophony of sound, and so we couldn't do that. But in a few minutes, I will be inviting people to raise their hands, and I will unmute you. But in the meanwhile, you can also submit questions via email at questions@independent.org. And so we've had questions already submitted, Ray, and I'm going to pose you a couple of these questions that we've gotten so far from people participating. Okay, question. How are Silicon Valley entrepreneurs and innovators stepping in? Where's the opportunity for that?
Broadly speaking, I've seen a couple of different avenues, one of which is that they're stepping in and using their engineering capabilities to repair old ventilators. So incidentally, and this is true in a lot of big states, there are ventilators which can work but need to be repaired or need to be recalibrated or something like that. And Silicon Valley entrepreneurs have done a tremendous job in trying to maintain and fix California ventilators. They've done somewhere in the ballpark of 5,000 of them.
That's fabulous.
This is in the course of a week, right? And these aren't typically like medical health professionals or medical technicians, right? These are just entrepreneurs seeing a problem and using their skills and solving it.
It's seeing a problem, solving it, and seeing that they can also benefit themselves and others at the same time.
Exactly. It's like we got to before, right? You're using the best and the brightest to solve the most pressing problem. I think another one, just to briefly touch on that, is that a lot of times they're increasing capacity for telemedicine to work, or what's loosely called telehealth. So right now, I mean, healthcare clinics across the country and emergency rooms, even primary care physicians are being overwhelmed with not just people worried they have COVID-19 or have the symptoms, but people that are just sick and trying to get regular medical attention. One of the interesting studies that came out of the journal Emergency Medicine says about 40% of regular doctor care visits can be handled through telemedicine. And what a lot of tech entrepreneurs in Silicon Valley elsewhere are doing is saying, okay, well, let's alleviate, if you will, people that need to go in and see the doctor, and then offer them telemedicine visits quickly and effectively. And a lot of healthcare providers are lowering the price for telemedical visits. And so, if you will, they're bifurcating emergency needs for COVID-19 and people with other general concerns.
Ray,
tech entrepreneurs doing that, I mean, they'd all be in the same room.
Another thing comes to mind, Ray, when you're talking. I understand that there had been a prohibition on doctors practicing across state lines, and that's been lifted too, and that's helping. Is that right?
Mm-hmm. That is correct, yeah.
Another great example, eliminate the governmental mandates and suddenly voluntary activity fills the space and helps solve the problem. Okay, here's another question just got via email. Says, one of our listeners says, the reporting of COVID-19 cases by government agencies or hospitals doesn't seem very accurate. This seems like an area where tech companies can make improvements. What systems do you think we need to accurately track COVID-19 cases?
I agree with, that's a wonderful question. I agree completely with the person who asked it, right? If anything, we are still underreporting. And a lot of that, at least domestically, comes from the fact that we didn't have tests when the outbreaks first emerged. But we're also seeing underreporting in China. We're seeing underreporting possibly in Spain. And the only real way to solve that and to get better information so you can better track if you're flattening the curve or designing policies effectively to treat the pandemic is you have to continue to loosen restrictions.
Right.
So frankly, I don't know how to best track COVID-19. If I knew that, I would be trying to do it, right? Because I'm worried too. But I know there are a lot of bright and capable people that are getting and developing better models to say, okay, well, this is our sample. How does that balloon out into the population?
Right.
And to the extent they're able to do that, I think we're going to have better estimates and we're going to know better policies and come up with better solutions.
Clearly, there's a huge opportunity in just this one area for those with a brain and resources to develop tech solutions to get this record keeping far more turnkey, far more instant, far more accurate. That could really help everybody out a great deal.
To add on to that real briefly, just to give the question asker a little bit of a more direct answer, I'd encourage them to look up the South Korean company Seengene. It's Seegene. And what they had to do to figure out how many, once they developed a COVID-19 testing kit, they had to figure out, okay, well, how fast is this disease going to spread? Which means how many of these kits do we need to produce? And they used a variety of technological techniques to try to approximate, okay, if one case comes in on this day in 3 weeks, how far will it spread through South Korea? And they did a miraculous job of that. But the only thing I can tell you about that is they were allowed to do it.
Right.
The government did not step in the way and say, don't, produce kits, don't produce kits. It's, we got a good product. We can save a lot of lives. Let's figure out how many to produce.
I'm just going to pause again for a minute now. We have a lot of friends on the line. If you want to ask a question directly to Dr. Ray March, what you do is at the bottom of your screen, there's a little thing that says participants. If you click on that, you'll see a list of names. Your name will be in that, or your ID, whatever. Select yourself and raise your hand. So for example, I'm looking at one of my friends here. You could go to your name on the sidebar, and under more, you can select raise your hand. So when I see somebody raising their hand, then I get to unmute them and they can ask a question directly. Okay, so here is William Shugart. I am unmuting you, Dr. Shugart, to ask a question.
Thank you, Graham. Ray, it's great to see another public choice economist on this meeting. The reason, my understanding is that the reason that South Korea has gotten a handle on COVID-19 is that they have enough test kits to do what's called contact and trace victims of COVID-19, whereas we're still only testing people that have symptoms. And that's why the data are so screwed up. We're sampling on the dependent variable, as a statistician would say.
Yeah. No, I think broadly that's correct. And I want to add a little bit more onto that. I agree wholeheartedly. That's one of the major reasons South Korea has such a good handle on COVID-19. But the way they've been able to get that information spread out, right? So what are the infected areas? Who has it? Where is the spread likely to be? That actually comes a lot, at least from the public's view, from phone apps or mobile apps. So there's a government one, there's 4 or 5 privately issued ones that use publicly available data and testing data they buy from companies that create testing kits, and then they distribute it to people that have the app and say, here's 50 new cases here, here's a very highly infected area here, somebody with it just got on the metro, or 10 people got on the metro, you may want to adjust accordingly.
Yeah. Thank you.
I am seeing here that there are Some other questions coming in from the email, but I'll remind you that if you want to raise your hand, you select your name in the participant panel, and I will see your hand raised, and I'll unmute you in just a moment. But in the meanwhile, here's a question from Mr. Lamerding. Thanks for sending this in. He asked, what about phasing in transportation and allowing mathematicians to set up original seating patterns? When should this be phased in?
Regarding my understanding of it, I think it has a pretty important role to play now. But part of the reason I think it's not being implemented, at least to the degree I would like to see, is because, like we've been talking about, the publicly available data and the data that's coming from government databases is not very accurate. So I think you're setting up a wide variety of skilled technicians and forecasters, mathematicians broadly, and you're giving them fundamentally bad data. So I think they have a role to play, but I also think that we're still, unfortunately, a little bit behind the curve, and their expertise is not going to be as highly utilized until we catch up with this testing problem.
That's very helpful. I'm still looking at my list of participants. If anybody wishes to ask a question of Ray March, you can do so. We'll just linger just a few more minutes here on this call. I see I've got a friend out in Illinois who is on the call. Gavin, if you have a question, I can certainly unmute you. I'd love to hear from you. I have a friend in Oklahoma. If you have a question, I can unmute you. I've seen a number of our friends around the country on this call. So just let me know by selecting your name and raising your hand. And then I will let you on the call. In the meanwhile, do you think there's any chance that people, Ray, will, public policy leaders in particular, and maybe citizens generally, will learn from this crisis that we need to keep these restrictions that have been temporarily waived down in the future so that we'll be better prepared? Or are we doomed to go back up to all the restrictive kind of controls that left us so vulnerable to this crisis? Can we ratchet the regulation down?
Yeah. Can you loosen Higgs's ratchet effect?
That's right. Explain Higgs's ratchet effect and from his famous book, please.
So there's a terrific economist named Robert Higgs who has worked at the Independent Institute for a variety of years, and he wrote a book several decades ago called Crisis and Leviathan. The fundamental thesis in the book is government grows, it tends to grow fastest when you have a crisis. He examines both of the world wars and a couple of depressions, as far as I remember, just preceding the First World War. And what he notices is government will grow at a very fast rate during a crisis, but when the crisis is over, the war ends, whatever have you, it doesn't return to where it used to be. It passes regulations and acts, and then it never fully gets rid of all of them, right? Or it increases its spending, and then it never actually goes back to pre-crisis spending levels. So the question here is, now that the government spent $2 trillion and shut down much of society in an attempt to block COVID-19 or flatten the curve, is it going to go back to where it previously was?
And if Bob Higgs is right, there's reason to be concerned. But on the other hand, if we can get the word out and highlight all these instances where the reduction of control actually benefited our public health efforts, maybe people will catch on to that. By the way, just as a reminder to everybody on the call, Independent Institute published the book Crisis and Leviathan, and it is available through our website. It's worth a read. And what's fascinating also is that we are getting people from around the country suddenly remembering about Bob Higgs's book, Crisis and Leviathan. It's getting cited elsewhere. There are interviews being done on the thesis of Bob Higgs's book, Crisis and Leviathan. Suddenly, the Independent Institute has a resource which fits the moment incredibly well. And it's due to the long-standing work and research of our fellows, especially economists like Bob Higgs, who have put us in a position to speak to the crisis in a very unique way. So I am thrilled to be part of an organization that has the resources built up over many decades to respond to precisely this kind of crisis. So we're just kind of come to the end of our call here. I'm looking finally for any last-minute questions from our friends, whether via email or whether by raising your hand on this Zoom participant list. But if not, let me just thank everybody, especially thank Dr. Ray March for being with us today. Ray, you've done a great job. We encourage you to keep on the work. People need to hear what you have to say. We need all of us really want to serve the common good and serve human dignity. And the way to do that is to unleash restrictions on creativity, initiative, and even profit making, because we'll all be better off to the degree that that can be done. And your work is very helpful in that way. I would encourage everybody on the line to daily visit our own coronavirus webpage. If you go to www.independent.org, you'll see in the middle of our main section of our website, front page website, that there is a place where you can click on our coronavirus info page, and we're posting all of our most recent coronavirus related materials on that page. You'll find all the written pieces by Dr. Raymond J there and others. It's a really good source for information on the crisis, and I encourage you to take a peek at it and keep up to date. And of course, we always welcome input from our friends and supporters. Make sure that you mark your calendar for next Friday, June 10th, at 11 a.m. Pacific time. We'll have another Lighthouse briefing call at that time. Our featured speaker is going to be David Ranson, who will discuss his recent paper titled "A Pandemic is Not a Recession." So that's going to be next Friday at the same time. We'll send an invitation out to all of our supporters on the call and others, and we encourage you to join us again. And again, we're so grateful to those of you who stand with us with financial support. Because of your support, Independent Institute has the resources that are needed. We are, in fact, moving forward and making a difference. And we want to make sure that America draws the right lesson from this crisis and not the wrong one, so we can escape from it more quickly and be more secure in the long run. And your giving to Independent Institute helps do that. And of course, if you want to help us immediately in that way, which we'd be grateful for, you can go to www.independent.org, and on the top right, you'll find a donate button. And of course, you can use that. So thanks for everybody joining us. Thanks, Ray. Thanks from North Dakota. Keep warm there.
My pleasure. Thanks for having me.
Stay safe and healthy, everybody, and take care. I hope to see you on our next call. Bye-bye.